So this is our co-design process for community integrated care about what services and support will look like, or the model, to use John's term, for extra care. And it starts here with the first meeting. Now obviously we know there's a lot of things that will happen before this, so we've picked it up from the very first conversation. It's going to be a relaxed conversation, probably over a cup of tea. And what we're going to be learning together is what really matters to the person and their family. And it may be that that's developed as a one-page profile and a family communication chart or plan as well. We do need to pay attention to assessments and needs and what the social worker has said the person needs and their outcomes as well. And of course we'll be paying attention to that, but we'll be building on it by asking the question, if I would, I could. So the outcomes that sometimes feel a bit impersonal in the way that they're described would then be truly personalised to where the person wants to be in the future. One of the things that's so significant about this is the person being able to start to identify their own team. And we've got a matching process to do that. So through developing a one-page profile, the manager, so we're assuming this is a lead senior person as well for each organisation, would be able to say, well, we're going to be matching for personality first, so I can tell you I've got these 5 staff available and I think their personalities would really, really fit who you are and what matters to you. So we've matched for personality and availability, and then we're going to match for shared interests as well. So these folk will be your team, but in 6 weeks' time we'll check out whether we got that right or not, or whether things have changed and you've not gelled as much as we'd hoped or whatever, but we're starting with you choosing your team. We also, because it's a co-design process, we're using the donut to get really, really clear for each visit what's core and has to happen, and that'll be based on the person's one-page profile and their outcomes as well, and where colleagues can use their creativity and judgment. And we know that to be able to give people full choice and control, for some people need to be exploring communication charts and decision-making agreements as well. So the whole process here is relaxed. It's about what matters to you. We use it to design your service using the donut to say it has to be like this each visit, and this is possible too. We choose who's going to deliver that with you based on personality characteristics and shared common interests. Of course we're paying attention to local authority information, but we take it further with if I could, I would. Now lots of people at that stage will be able to make the decision to come and be supported by community integrated care, but of course we're not going to insist on that, so we're going to ask the question, what will it take for you to make the decision about whether you want to live here and be supported by us? Is there more information that I can give you, or the people that you want to meet? But then as soon as the decision is being made, what we also do, and possibly here if the person has made the decision, is that we co-design their moving in and settling process. So we really explore what it's going to take for the person to feel welcomed and settle in the first 6 weeks. We know that part of that will be meeting their personal team and other important people, which will include the people who do the night shift as well. We'll be talking about wellbeing checks, how we keep checking in about how it's going. And we always do that for 2 weeks, and then we tail them off and go at the person's pace as well and figure out with the person how they want to do that. There's a beautiful welcome pack that people get that's personalised to the service, so they really understand who to speak to about what, how all this gets organised, all the information that they need. And the team who's supporting the individual in the first 6 weeks are completing learning logs, because we know however good this conversation is here, we can't learn everything there is to know about the person, so we need to do that to capture what else we learn. And of course, learning about people's history can be really important too, and we start doing that here as well. So let's imagine the settling in process. This 6 weeks goes really, really well. So after 6 weeks, we're having a sort of how's it going meeting and conversation. We'll be figuring out what's working and not working from the person's perspective, colleagues' perspective, and the team's perspective, and the manager's perspective too. Or we might use 4+1 to review that as well. We'll be checking out and updating the relationship map and seeing how that's going, updating the community map and seeing how that's going. There may be other person-centred thinking tools that we find useful there as well. And of course we'll be making sure the one-page profile and the outcomes are updated, and outcomes we usually describe as if I would and could. So that process continues at 3 months and 6 months. We keep asking what's working and not working. We design people's reviews with them, typically using working, not working, but making sure when and who and how it goes is something that people are in control of as well. We do another review at 3 months, but if the person wants that to happen differently, that's absolutely fine. But a more formal review at 6 months too, in the person-centred review style. We also start to introduce the difficult conversation about end of life and making sure that that's happened by 3 months and going at the person's pace. So learning and reviewing at a 3-month review and a 6-month review, and we use that information to inform how the person wants the service to change as well. And we do that from the person-centred review, taking the top 2 working, top 2 not working, top 2 things that people want in the future,